Hey guys, welcome back to my YouTube channel. Today we're going to go over how to breathe to get out of pelvic pain. Now, if there's one thing from the research that you should know, it's that virtually all people who suffer from chronic pelvic pain have an overactive fight or flight system. Or you could say their sympathetic nervous system is on overdrive all the time. That's why we're going to use breathing, which the research also shows can help us get out of that. And we can use breathing in other ways, which we're going to cover in this video, to make sure that you're maximizing all the tools available to you to help you get out of pelvic pain. Let's get into it. I want to first tackle how you should breathe. So a lot of you have seen, for example, diaphragmatic breathing as a way that you should breathe to relax, to avoid stress, as a breathing strategy in general for how you should breathe all the time. And that is not what I'm going to advocate for you. And the reason why I don't believe in diaphragmatic breathing, especially for those with chronic pelvic pain, is that when we're just breathing out through here, we're getting a lengthening of the abdominals. And if you have overactive, hypertonic, really tense abdominals, then diaphragmatic breathing actually can be very helpful for you. And I have recommended it for some individuals. However, I never recommend it for those individuals that have pelvic pain because it's not here, which is hypertonic and tense. It's actually the pelvic floor muscles right in the perineum area here that is hypertonic, and we want to breathe into there. So in fact, we want to change this diaphragmatic belly breathing into diaphragmatic pelvic floor breathing to make sure that we're lengthening, we're feeling those muscles, and we can feel them start to relax as we slow down our breath with our inhale and our exhale. So the other thing too that I want to chase is that you have to feel that area expand as you breathe into it, okay? So I'm gonna take a few breaths, and don't forget, I've used all these strategies that I explain in all of my videos about pelvic pain to get out of pelvic pain. I've learned them from textbooks, physical therapists, and experimentation, and the research that has gotten me out of chronic pelvic pain, and I want you to get out of it, so I want you to try these techniques and make sure that they're actually helping you, and I wanna hear your feedback. So I'm going to take a few breaths breathing into my pelvic floor, and you might ask, how can you do that? Well, I'm going to show you exactly how to do that here. So when I inhale, that's when I'm going to expand. Just as though you would do diaphragmatic breathing on an inhale and expand your stomach, you're going to expand your pelvic floor. So I want you to imagine that this balloon is your pelvic floor, so you can have it be here. And what happens, this is going to be at my waist. This is my pelvic floor, so imagine, this would be the genital area, this would be, so spine here and abdominals here. This is my pelvic floor area, or my perineum area. When I inhale, you should feel it do that, okay? Inhale. And then when you exhale, you're gonna relax everything. Inhale, relax everything. So again, when you inhale, your pelvic floor should drop. You should feel air expanding into that, okay? Now, one other thing I need to add is this. It's that although you feel primarily air expanding or pressure expanding into that perineal or pelvic floor area, you need to be expanding everything else as well, okay? That includes your stomach, your chest, your side abdominals, your whole back. Everything is expanding, including that pelvic floor area. When you do that, you're signaling to your whole upper body to relax, and that's critical for the pelvic floor muscles because a lot of the muscular and the fascia chains are all interconnected. So we need to have actually everything start to relax, but I need you to focus on that pelvic floor whenever you inhale to relax. And then when you exhale, this is critical. You need to have a relaxed inhale, but the main thing I want you to do is make sure that you are exhaling fully I don't want you to use your abdominals too much for that. If we use our abdominals too much for that, we will often get a co-contraction in that pelvic floor. So I need you to just let yourself exhale all the way. You might need to just minimally push it to get out all your air. The most important thing is doing it slowly though. So again, for breathing technique, we're gonna be breathing into our pelvic floor, and at first it's gonna be difficult to really be able to tell if you're feeling that area. All I want you to do is practice it for 2 days. And if you don't experience any improvement with it, this tool is probably not necessary or gonna be useful for you. But I guarantee that if you practice it in 2 days, most of you are gonna experience a relaxation, and you'll be able to tell that your pelvic floor is relaxing. And actually, this brings us into our next tool. You're gonna be able to tell where your tension level is for your pelvic floor muscles. Now, there are gonna be certain positions, and I'm gonna cover these in later videos. There's gonna be certain positions that we wanna get into that can really help your pelvic floor relax the most. Now, these positions aren't necessarily universally helpful for everyone who has chronic pelvic pain, but you need to try these out if this can allow you to relax easier. Now, using the breathing technique with this, it can tell you how tense you are depending on the position. So for example, when I had my worst bouts of pelvic pain, standing up was not good for me. I had to get into a deep squat position like this, and I had to practice these breathing techniques, which helped me to fully relax. I also did soft tissue work, like you can see in the link with this video, to help warm up those tissues, and that also helped me relax even more. Here's another tip. You can do these in the shower, in the bath, but make sure that your body is very warm when you do this. The research is clear that when the body is warm, and specifically that pelvic floor area, it relaxes even more. So it does help. So you gotta make sure that you're warm when you're doing these. Okay, now the final tool is I want you to use breathing and be aware of breathing into that pelvic floor area as much as possible throughout the day. And that includes when you're sitting down, when you're standing up, when you're lying down, even when you're going to the bathroom, when you're walking, if you're doing any kind of exercise, which I know a lot of you are prohibited from doing because you have pelvic pain. Well, I want you to find the best positions for yourself and monitor your tension levels and try to stay in those positions or movements which allow you to have the least tension. And I think you'll find is that the more and more that you're cued into breathing and using that inhale to expand and a relaxed full exhale, you're gonna be able to tell and sort of guide your body into finding the best possible postures and movements which can decrease your pelvic tension, thus leading you into decreased pelvic pain. So if you have any questions or comments, let me know. Please subscribe to my channel if you got anything out of this. Thanks for watching.